Seizures. Now, a seizure is caused by a sudden burst of excess electrical activity in our brains, causing a temporary disruption in the normal messages passing between our brain cells. This disruption results in the brain's messages kind of becoming halted, confused and all mixed up. And we can have convulsive seizures and also non-convulsive seizures. The difference is a convulsive one is something you might have associated with the word fitting, whereas a non-convulsive is when someone is kind of daydreaming, having an absent seizure. Why somebody might have one of these seizures? What could cause it? Epilepsy. Now, epilepsy is actually currently defined as a tendency to have recurrent seizures. But people can have a seizure because they've hit their head, so they've fallen over, or they've had a sporting injury and hit their head, they can have a seizure. You can have one if you're a diabetic and a hyper or hypoglycemic attack. Also, if people are withdrawing from drugs and alcohol, it can cause them to have a seizure. And young children can have what we call a febrile convulsion. That's when they get too hot and the brain can't deal with that just yet, so it has a seizure, a febrile convulsion. So there's different reasons why somebody might have a seizure. There are a few others as well, of course. Now let's talk about these seizures, because our brain is responsible for all the functions of our body. So what we experience during a seizure will just depend on where in the brain the activity begins, and also how widely and how fast it spreads. And for this reason, there are many different types of seizures, and every person might have a completely different seizure. So never think there's a normal seizure. Now, I'm going to give you a description of a typical type of seizure, but remember we said there is not a normal type, and everyone is different. Now, a tonic-clonic seizure is the most common type of generalized seizures. And this is when our body just becomes rigid due to strong muscular contractions. That's what we call the tonic stage. You will then lose consciousness and you'll fall, and that could cause injuries. So this stiff or tonic phase, as we call it, passes then into the clonic stage. And the clonic stage is a convulsive bit. And this is when the muscles, all they do is kind of repeatedly contract and relax. So your whole body just appears to shake. And this may last for a few seconds to a few minutes. Now, some of the key things you're going to be looking for in a seizure are as follows then. Sudden loss of consciousness. A rigid body with an arched back. Noisy and difficulty in breathing. Convulsions. And sometimes you might see somebody losing control of their bladder. And then afterwards, they're going to fall into a deep sleep. Now, when the seizure has actually stopped, the person's going to gradually regain consciousness, but may still be confused and dazed for quite a while afterwards. The time taken to recover will vary between person to person, and different seizures as well. The person may have some soreness due to all those muscles just contracting involuntarily. The person might also have a headache, and they might want to sleep for quite a period of time after the actual seizure itself. Now, sometimes people have auras, which are kind of warning symptoms for a short period of time before the seizure. Now, this doesn't happen all the time, and it can take various forms. For example, somebody might show odd movements, maybe wear the clothing on back to front. Maybe they can smell rain or taste something metallic in the mouth. Every person is different, remember, and not everybody has these. Most seizures commonly occur without any warning whatsoever, and that's what makes it so dangerous. So let's talk about the treatment that we would do as a first aider if we experience someone have a seizure. When someone has a seizure, it can be a really frightening thing for a first aider to deal with, especially if they've never seen it before. And the first thing I would say to you would be, take a deep breath and stay calm. Then you need to make sure that casualty is safe, so protect them. Move objects out of the way so they don't hurt themselves. Protect their head with a bag. Never hold it and never restrain them, but protect that head with a bag or a cushion. Start timing the seizure. The timing's important. We'll come to that in a second. Then maybe if you don't know the history of that patient, you don't know who they are, start looking for medical ID, bracelets, necklaces, look on their phone, look in their wallet. Be careful when we do that, because that medical ID alert can give you more information about what to do for the casualty to help them recover. Now, when the seizure is finished, That's when you can check they're still breathing and then place them in the recovery position. And keep talking to them throughout until they fully regain consciousness. So please, let's go over things you should definitely not do. And these are kind of old wives' tales that people have done historically. Please never ever restrain the person. Do not put anything in their mouth. Do not move them unless they're in danger. Do not attempt to bring them around. And do not give them anything to eat or drink until they are fully recovered. Now we must always call the ambulance as a first aider if we don't know the history of that patient and it's their first seizure, or we think it's their first seizure. We're always going to call the ambulance if the seizure lasts for longer than 5 minutes. We're going to call if one tonic clonic seizure follows another one without the person regaining consciousness between those two seizures. In other words, 2 seizures together. And if you believe that person needs urgent medical attention, you're going to call the ambulance. And of course, you're always going to call the ambulance if they're not breathing, which is very rare, but you've got to call the ambulance then and obviously begin CPR. Now, if someone has a non-convulsive seizure, the daydreaming one, then as a first aider, all we're going to do is monitor them, make sure they're safe, and time it. And when they recover, we're obviously going to tell them what has happened and report it to next of kin or guardians if needed, and depending on the age of them.